Hi guys, today I want us to learn more about Ozempic. Ozempic is a medication that is usually used to treat diabetic type 2, but most people have been using it in these days to manage high weight or overweight. Now let us know more about Ozempic. Ozempic was primarily used to treat Diabetic type 2. So these Ozempic drugs, its great effect on human body is to lower blood sugar, which leads to a lot of weight loss. So because of this effect of Ozempic to make someone lose weight, that is why it drew a lot of attention to many people to start using it as a base for weight loss. But primarily it was not made for weight loss, but to manage high blood sugar in the blood. So what does Ozempic do in human body? Okay, Ozempic, it stimulates the insulin from the pancreas. You know pancreas that is found in human body. It stimulates the pancreas to release insulin in the blood. So what does insulin do? Insulin stimulates cell intake of blood glucose. So when the pancreas releases insulin in the human blood, when the blood sugar is high, this is your blood, it has high sugar in it. So what the insulin that is released stimulates the blood cell to absorb the insulin or good blood glucose to go inside the cell in order to be used as energy. So by that, it lowers high blood sugar. And by that, it reduces the amount of blood sugar in your blood that could have been converted to fat in your body. That is one way it makes someone to lose weight. So it also reduces the amount of sugar your liver makes. That is another effect of Ozempic. It reduces the amount of sugar your liver makes. And when it reduces the amount of sugar the liver makes, by that, when the liver reduce the amount of sugar that it make from the food you eat, most of this sugar that the liver make, most of it go to be fat, because maybe you don't do a lot of exercises, maybe the sugar was too high, you eat a lot of sugar, it will go and be converted to fat as a storage system. So one thing that Ozempic do is to make this liver stop or reduce the amount of sugar that the liver produce, and by that it lower your fat in the body by doing that. So another major thing that Ozempic do is it slow down. Slow down is to mean something is being delayed. Yeah. If water was supposed to flow very fast in a track, it is being slowed down. If it was supposed to take 10 minutes, it is now taking 50 minutes because the process is being slowed down. So what happened? What is the exact effect of this Ozempic in this whole case of slowing down? So Ozempic slows down the emptying of your stomach. So when you eat food, the amount of time the stomach takes to digest the food, let's say 30 minutes, until the food gets to the anus to be excreted from the body. If it was to take 3 hours, Ozempic will slow down. That is by triggering the CNS and the digestive system, and then the peristalsis of the intestine. It is slow down the process, and the process take too long. And because there is still food in your body or in your gut, you continue feeling fuller and fuller and fuller for a very long time. And by that, you don't feel hungry. You continue feeling full for 6 hours. And when your stomach is full, of course, you don't feel like eating. And by that, maybe you are doing some work, you are using energy, and you remember it also make the liver to reduce the amount of sugar. It make the cell to uptake the glucose in order to produce energy. By all those things, you are not eating. The glucose is being converted to energy. Combine all those things, and that is how Ozempic also made people to lose weight. I think this is a safe way to lose weight. Imagine you feeling full, you are not eating, you eat a very good diet in the morning. You stay like that for around 7 hours without eating because you feel full, you are not hungry. Wow, that's another thing. Another thing that Ozempic do is to reduce the appetite. Appetite. Appetite is that urge to feel. You feel when you want to eat food. I want to eat food. I'm hungry. I want to. You see that appetite or that urge that someone have when you are being given food on the plate. You feel like, wow, I have food on my table. I'm going to finish the food. But now what Ozempic does is that feeling of liking food or wanting food. I love mchere, I love pilau, I love choma. That feeling is being reduced drastically. You don't feel like eating anymore. That is how it is being explained by reducing appetite. Here is your Dr. Lucy explaining to you how Ozempic does to your body, because it's good to understand what is happening in your body. It's good to understand what is all about the famous Ozempic that people are using nowadays. A minute, I'm coming back. So guys, let us go ahead exploring what? Exploring Ozempic. Again, I'm your Dr. Lucy here. Trying to explain to you what Ozempic does. So one thing we said, it is treat diabetic type 2, and also it reduces the risk of. These are advantages. What are the benefits that you have when you are using Ozempic? You have a lot of weight. By taking Ozempic, you reduce the chances of you getting diabetes type 2, and that is great. That is good. Yeah, you are on the safe side. Another thing, you reduce the risk of major cardiovascular diseases like hypertension, like cardiac disease, hypertension, cardiac disease. Because remember, when you have a lot of weight, your artery and veins are clogged with fat. They are clogged with fat. And by that, the pressure of the blood is increased. Suppose you have a pipe of water which was so wide, the pressure of the water is down because the flow is just slow and comfortable. But when you place that pipe, the pressure will be very high and the water will go very far with a lot of pressure. This is what happened when your vein and artery are clogged with fat and plagues because you are fat. The pressure of your blood increase, and that is how you end up having high blood pressure. And remember, high blood pressure leads to a lot of other things like kidney disease. Actually, high blood pressure is the cause of high kidney disease in most people, because when the pressure is like this, some artery like that to treat the kidney. The kidney does not get enough blood, and by that you end up getting kidney disease. So just go back to Ozempic. And try to follow on what I have told you to prevent high blood pressure. High blood pressure leads to kidney disease. So when you take Ozempic, you are kind on the safe side out of these two major diseases. That is type 2 diabetic and hypertension. Yes, guys. So let's go ahead. For Ozempic, it is sold in pharmacies or in drugstores by qualified medical practitioners, pharmacists. So it is taken once weekly injection. The injection has 8 dosage, and that dosage is going to be directed by your physician. Yeah. You start with a low dose and increase gradually to reduce the side effects. What does that mean? When you are taking Ozempic, first time, start with a low dose. Don't start with a high dose. Start with a low dose. Continue increasing as your body get used to it. Continue increasing. Increase as your body get used to it. Don't start with a high dose. Now, when you are taking this famous Ozempic, what are the side effects? Side effects are the things that come negatively in your body as you take this medication. They affect your body negatively due to one thing or the other. So the first side effect that you experience when you are taking Ozempic is, are you listening, guys? Is you have nausea. You have nausea. Expect nausea when you are taking Ozempic. Just know how to deal with your nose. It is common. Don't get nausea when you're taking Ozempic and start panicking, saying, "Oh, I'm feeling nausea. Maybe I have another." No, this is just a side effect. It's common. It's manageable. You can stay with it. It's okay. Another thing is vomiting. Some people will even vomit when they are taking Ozempic. You will feel nausea. Some people will end up even vomit. That's just a side effect. Calm down. It will just go by itself, or you'll just know how to live with it, because it's just there's a side effect of Ozempic which you are taking, and it has benefits. So there's nothing that has no good or no bad effects. So that's another side effect. Another thing is diarrhea and constipation. Your stool will be hard. Remember, there is slowed gastric emptying. Digestion was slowed. So because the digestion was slowed, expect even the digested food that is supposed to be excreted as feces, instead of staying in the gut for 3 hours, it is now staying in the gut for 6 hours. So the water that is in these feces, it has been absorbed back to the body, and that is why you become constipated. The stool becomes so hard. By this, you can solve it by taking a lot of water. Take a lot of water when you are taking Ozempic to prevent this constipation. Yeah. So another thing is stomach pain. We are going to have abdominal pains. Yeah, you see, you are going to have abdominal pain, stomach pain when you are taking Ozempic. Don't panic. Don't go taking other medication or whatever. Just know you are having a side effect of what? A side effect of Ozempic. a side effect of Ozempic, right? Another thing, when you're taking Ozempic, another side effect, you are going to have reduced appetite. You are going to have reduced appetite. Remember, this is helping you not to eat too much, and by that you are going to lose weight. So it's a good side effect. Yeah, let's go ahead. There are most common when starting or increasing the dose. So this side effect that we have discussed. Are you getting me? This is side effect like nausea, vomiting, diarrhea, stomach pain, and decreased appetite. They are going to come when you are starting the Ozempic. And when you increase the dose, maybe you started with 10 IU, you are now taking 30 IU. You are going to experience this, but when you get used to it, the symptom or the side effect will just go away. Okay, are we together? Are we together, guys? Are we learning? So let's go ahead. Let's go ahead and look to the dark side of Ozempic. Yeah, the dark side. The dark side of Ozempic. And these are rare. They are rare. You never know whether you are in that small percentage of rare risk of taking Ozempic. The first serious rare risk is pancreatitis. Pancreatitis. Yeah. You are going to have pancreatitis. Another thing is gallbladder stones. Another thing is thyroid disease. Those are the three major these are the three major risks of taking Ozempic. Yeah, the pancreatitis, the gallbladder disease, and thyroid disease. So many people lose about 5 to 15% of their body weight. Many people lose 5 to 15% of their body weight over time, depending on the dose and lifestyle. So when you are taking Ozempic, make sure you also do exercise to help you lose weight. Yeah. Yes, now that is all I have today for about Ozempic. I think it's a safe drug, but still it has its side effects. My advice is when you're taking these Ozempic drugs or this Ozempic injection, make sure that you take a lot of water. Make sure you take a lot of vitamins. Vitamins help to exit toxin in the body. And overall, avoid a lot of other medication or drugs that will put toxic in your body. Because when you combine Ozempic and you are taking other drugs or things like caffeine in too much percent, remember caffeine causes kidney stone. Ozempic also has an effect of forming. Of course, you definitely go to having kidney stones. So when you are taking Ozempic, avoid a lot of drama. Avoid alcohol. Don't take Ozempic and you know you are taking alcohol. Yeah. You are taking alcohol and you are not taking vitamins. You are not taking enough water. My friend, you will lose the weight, but you will go into another dish. Do you want that? No. So, it's your Dr. Lucy here. And this channel is just for education, especially the medical cases, your health. Ask any question, comment anything. Let me know the next topic that you would like to know from him. And I'm so glad. Thank you for joining me. See you to the next video. Yay! I love you. So I'll go visit him. Then my mom is coming. Remember I told